So you finished all your clinicals, you graduated, and you passed your NCLEX. Great. I would hope by now you know the field of nursing that you want to go into. But I know that there's a handful of people out there that don't know. They go through all their clinicals and they're just like, cool, that'd be cool, that'd be great, pediatrics cool, psych is cool, OB is cool, but I don't really know what I want to do. I'm here to make a video today just about what it is like to be a psychiatric mental health nurse. According to the BLS, in a study done in 2016, 37,910 nurses were employed as a psychiatric nurse, compared to the 1,644,480 nurses working in general surgery. Based on that, with our shortage of mental health professionals, it's kind of important that we need more psychiatric nurses. Okay, so this is what your day is gonna look like. You're gonna come into work, you're gonna clock in, you're gonna sit down and report. You're either gonna have a live report, which is gonna look something like this. Hey guys, so I had 5 patients today. I'm gonna start with Jane Doe in 423B. She's here for major depression under the care of Dr. Boop Bop Beep. Her vitals were stable today. She denies any pain, denies SI, reports moderate anxiety and depression, or tape recording. And it'll be something like this.
Hey, so I have 5 patients today. I'm going to start with 425A. John Doe, here for unspecified psychosis under Dr. blah blah blah. Denies pain, denies SI, denies anxiety and depression, denies ABH, but she does state feeling better than when I first got.
After your report, you're gonna have this patient load. On your patient load, you're gonna have to do a couple of things. The 2 most important things: you're gonna have to pass medication and you're gonna have to chart. Charting is everything. Remember that. When you meet your patient, you're gonna wanna do a couple of things for their assessment. Now, this assessment isn't gonna be like a general surgery or any other medical assessment. The psychiatric nursing assessment is more localized on how the patient is doing for the diagnosis that they came in for. So say I get a patient that is here diagnosed by the doctor with major depressive disorder, recurrent severe, with psychosis. Start off with like the 5th vital sign. Are you in pain today? And if they say no, cool, great. And then I go on, are you having any thoughts of harming yourself? If they say, yes, I want to hurt myself, I'm gonna try to specify that more and say, do you have a plan? If they say, yes, I have a plan, I ask what the plan is. After that, I wanna make sure that they're in plain sight of view. The nurse's station, I let my staff know. And I also ask them, do you feel safe in the hospital? And if they say yes, then that's good. I go on and I say, I assess the level of anxiety, I assess the level of depression, guilt, worthlessness, and this is based off the charting and documentation that my hospital has. Yours will probably be different. So just remember, you're gonna have to do that process 5 times if you have 5 patients. And they're all gonna have different diagnoses, they're all gonna have different problems, different medical problems, chronic problems. Now, based on the way that your hospital is staffed, you might also have to do discharges, admissions, and transfers to different units. So that's basically a quick run through of what it's like to be a psychiatric nurse on a daily basis. What it's like to be a psychiatric nurse on a general, more broad basis, just on how it feels like. I'll say that if you work 5 days in a row, you will be mentally exhausted. You will have given a lot of care and empathy to people that really need it. But at the end of the day, it's very fulfilling. So I want to end this out with a couple tips or pieces of advice just for any first-year nursing graduate. So I have 4 pieces of advice. First one is know your place. As a first-year nurse, you're going to know a lot of information. You're going to know everything by the book. And then you're gonna find out that not a lot of people go by the book. So don't start in your new workplace and be that know-it-all and be like, well, this is what this says. There's a culture on every unit. You're gonna become part of that culture and you don't wanna start off on the wrong foot. Second one is be a sponge. There's gonna be so many nurses out there, so many older nurses that have so many years of experience on you. Learn from them. Take everything that they have to say and put it in your backpack. Put it in your mind. Someday in the future, you're going to use the advice that they gave you, and you're going to be thankful for it. The other one is make a friend. Make it your goal to make one really good friend on your unit when you start. That way, when things go downhill someday, which they will, You have at least one person that has your back. And the last one is know your diagnoses and know your medication. You should be able to open up your patient's chart, look at their medication list, and know ballpark what their diagnosis is. And if you know that, then at least you have a good, confident backbone. That's all I have about what it's like to be a psychiatric mental health nurse. If you have more questions, let me know. If you're a psychiatric nurse yourself, is there anything that I missed? Cool, that's all I have. Bye.